Hello, I'm Ryu a breast surgeon at Bucheon St. Mary's Hospital. Yes, there may be various complications, but first, let me explain the various complications that could happen after the surgery. Patients would worry if they can go back to their daily lives, such as working after the surgery. But the level of pain patients complain about is less severe than you'd imagine. They may feel uncomfortable on the day and the next day of the surgery, but after a week, patients wouldn't have any troubles with their daily lives, so you don't have to worry about the pain. And we will be prescribing light painkillers for the pain right after the surgery, so it wouldn't be any trouble to get back to daily lives, and that's how fast the surgery will take as well. Besides that, we proceed with an axillary lymph node surgery at the same time, so patients' shoulders or arms can feel slightly uncomfortable. There may be a case where one could feel pressure on their joints or muscles as well. So when this happens, our hospital provides rehabilitation from the collaboration with the Department of Rehabilitation by helping patients ease their joints and help with their exercises. And other than that, patients may experience swollen arms from lymphedema. So in this case, sentinel lymph node dissection is performed. It's relatively small, but it's not unlikely, and there's a chance it spreads to the lymph node. And if patients went under the axillary lymph node dissection as well, then the risk level can increase slightly. So, we often recommend that the patient limit heavy arm exercise or movement temporarily. So, in such cases like this, it might ease with the time, but sometimes symptoms may appear even years after the surgery, so I recommend that one doesn't put too much pressure on their arms. This question is one of the questions most patients worry and ask about, but we recommend that patients go back to their daily lives in ways not so different before their surgery. Of course, as a cancer patient going through treatments, it is good to be aware and on the lookout of reoccurrence of the cancer. In our hospital, we continue to follow up with checkups every 6 months for 5 years after the surgery to see if there are any abnormalities. So, just in case, during these periods in time, if there are any abnormalities, patients can go see a doctor. And other than that, patients just need to continue with the treatment that was given and continue their lives just as it was. And one of the questions that the patients ask is, in regards to the consumption of food, drink, or health supplements, we tend to recommend that they need to have a balanced diet. However, we do consider female hormones one of these causes, although we give hormone replacement therapy, especially for patients going through menopause. It's good for them to avoid specific kinds of food, especially pomegranate and red ginseng. Other than that, there is no specific food to avoid, and there are various health supplements on the market, but most of those are not proved to be effective at all. On the contrary, it could be toxic for their liver or kidney when consumed. So, be cautious when consuming those supplements. Smoking and drinking are among the risk factors that cause breast cancer for sure. So, it's not recommended to drink heavily or smoke for the patient's own health. Other than that, it is known that female hormones increase if one is overweight. So, it is helpful to control weight and exercise in terms of managing cancer. Yes, I mentioned at the start about the age. Of course, we have patients that are 20-something and patients in their 80s. Any woman can get breast cancer. However, it is quite rare for females in their teenage years to get breast cancer. But Still, if one feels a lump, it is better to first go see a doctor. But I'm sure it's not much to worry about. In many of these cases, it's just a benign tumor. Usually, if you get a surgery, we do a routine follow-up check every 6 months for 5 years after the surgery. It includes mammogram and ultrasound, which was conducted before the surgery, an abdominal and chest CT scan, and bone scan. We conduct checkups for the whole body, including those mentioned above. If we find abnormalities in the testing, we extend our test further to biopsy. Or we could consider the whole body scan, such as PET-CT. When a patient goes past 5 years after surgery, we give more time when scheduling a follow-up visit. So the follow-up visit will be once every year. And after 10 years of surgery, you can consider it is safe. We skip the whole body test because we consider that the whole body cancer recurrence is unlikely by the time. So we just focus on screening tests, such as breast ultrasound and mammogram. Today, we have talked about the several complications that can happen after the surgery and things that can help manage after the surgery. Thank you.